Good morning, everyone. It's a pleasure to be here and to be on this webinar on digital and innovative tools, where we are talking today about contact tracing in public health. It's something that we have all been at least hearing during this pandemic time. So my role here is just to do an overall context. It's very simple. I'm work package 5 leader within FHIRI project, public health information research infrastructure. In work package 5, we are interested in methodologies, data, and research pathways within COVID-19, and we are working hardly to have all this. And we are also very interested in contact tracing and artificial intelligence and other innovative tools that are being used and studied along this time. So this is our main motivation within this FHIRI project. So what we have planned for this half an hour, 1.5 hours, about 90 minutes, is to have an overview of our motivation, and then Luís Lapão will be doing the context of this contact tracing initiative today, and then we'll have 3 presentations. It just happened to be 3 ladies that have been working on this contact tracing subject. So we'll be having first Laura Maaß, I hope that I'm saying the name correctly, from Bremen University, that will give us an overall perspective of the contact tracing in public health. Then we'll have Renata, no, it's Mariana Peyroteo from Nova University in Lisbon, that will be doing an overview of contact tracing in Europe. And then we'll have Márcia Luís from our university here in Lisbon, Faculty of Medicine, University of Lisbon, that Márcia has been modeling contact tracing in the Portuguese context, and she will be giving you her perspective and the implications, at least from the human resources that it has or it could have. And then we'll have a discussion. We have planned about 20-something minutes to discuss. Hope that's fruitful and enough. And we hope to end at 12 sharp. As I know Luís, he likes to be very punctual, so we'll strive on that. And that's basically it. So if everything is set and ready, I'll pass the floor to Luís to give the context of this seminar and webinar.
Thank you, Paulo, for your introduction. I just want to say a couple of words, nothing more. I think we are here presenting 3 different and complementary presentations. I'm very happy to see this, because I was really in the beginning somehow afraid that we could be talking about the same thing, but now it's different and complementary presentations. I could say that it's a kind of all what you want to know about contact tracing and were afraid to ask. So at the end, we can have a discussion about that. But we should understand that healthcare is about information. It's driven by information. And so the tools to help us use and leverage the value of information are very important. And so we can start from IT governance to information governance to security, safety, privacy, the application of a GDPR, big data. So the big value of big data in healthcare is a promise that we are still lagging behind, because we cannot have interoperability, which is a very simple concept. So we can all use the same words and language to use information in healthcare, so we can communicate and share information in a proper way. We have been struggling to have this interoperability, but finally Europe decides to go for the federated system. So we find a way. It's tricky. It's a tricky way to make sure we can understand each other. It's like starting speaking English instead of having our own language. But also, as Paulo mentioned, we have artificial intelligence that will help us to understand better the value of patterns in healthcare, but also blockchain that could be also interesting to make sure the information is not it's certified, it's guaranteed, it's secure. So we have this challenge, and how can you use this information, these tools in public health? So the COVID-19 pandemic brought us here. So we have this situation, and now we have these tools available in other industries. How can we make use of this in healthcare? And this challenge is still there. It's a big challenge. There is a lot of new projects on these areas, but we are here looking for very specific and probably very useful, with a lot of potential, that is contact tracing. And as you know, contact tracing didn't work, and they will explain us why and what was the issues regarding the utility of the contact tracing. But is there a future for contact tracing? Can we dream of using contact tracing in the next pandemics? We'll expect our ladies to present their ideas and share their research, so we can have a broader discussion about this afterwards. So thank you very much to the presenters. Thank you, Paulo. Thank you, everyone, to be here. So I'll pass the floor to Laura Maaß from University of Bremen. Please, the floor is yours.
Thank you, Luís. So let's share my screen. Okay, I hope you can see all the presentation mode right now. Okay, just because I'm highlighting.
It's okay.
Okay, you can see it. Okay, can you also see my mouse if I'm moving to point out things?
Yes, yes.
People nodding. Great. Okay, then thank you for having me here today. I'm actually doing my PhD at the University of Bremen at the Leibniz Science Campus for Digital Public Health, in which we are also researching contact tracing and COVID-related topics. So I will present to you the German perspective on things. The agenda is that we'll talk a bit about the case of Germany, the contact tracing apps that we have in our app stores, us Germans and our probably well-known internationally trust issues when it comes to digital data privacy, the discussion whether or not we want a centralized or a decentralized app, and then I present the most common used apps. We'll talk a bit about, are they effective? There is right now no evaluation of whether or not they are effective, so it's just an opinion. And I want to highlight some key requirements that we need to develop successful contact tracing apps. So 2 days ago, I searched the Google Play Store and the Apple App Store for COVID-related apps, and I found 53 apps. I would think that there are even more for regional and in areas in our concrete cities. And you can see that contact tracing is actually one of the biggest shares. Those test results as a relatively new share, because we just recently started to upload our tests and have our test results digitally. And then we get this huge group here of dashboards, which most of them are referring to the Robert Koch Institute's dashboard, and they're just displaying the map differently. So if we look at contact tracing apps, we see that the majority is actually from private companies. And it's only some that are developed by public institutions. And those two here are the majorly used ones. So we got the Corona One app, which is developed by the government, and we got the Luca app, which is actually developed by musicians and private companies. Looking at our trust issues, as you know, Germany has quite a history when it comes to trust issues. Just to remind you of the Stasi and some data leaks that we had. So most of the population still assume that their data is unsecure and unsafe on the internet. However, we also see a trend that the term that the area on the share of the population which thinks that their data is safe is increasing. So that's I guess a good thing for contact tracing apps. Trust is important for digital public health tools and for public health tools as well to work, because we need to reach a lot of the population with them, that they don't work if just some people use them. And so we need them to trust in our interventions. And Lynn et al. Developed a principle list for trust in digital repositories, which I think we can adapt to the case of contact tracing apps. So they said they need to be transparent, responsible, have the user in the focus, be sustainable, and the technology should be provided in a secure, persistent, and reliable way. And I think we can use that for contact tracing apps as well. Now my computer is frozen. Okay, sweet. So just a wrap up. I think you're all familiar with the differences between a decentralized and a centralized app. Just a short wrap up. For a centralized app, all keys for all people that you've met are uploaded to a central server, which means that we got not only the data on the positively tested individual, but also on all the users that this person met. They're all stored in a central cloud. Which is great for research. However, if there is a data leak or if the authority overseeing the server isn't as responsible and nice as they frame to be, this can allow for long-term spying, which is why most people in Germany were concerned when we had the discussion that we want to have a centralized app. The decentralized app, however, only uploads the key of the person that was positively tested and only for the duration of the time at risk, so only for 2 weeks. That means we don't know anything about the users that they've met. We only know about the infected person, which limits the amount of data that we have, and it's only uploaded for 2 weeks before it's deleted again. So we don't really know anything, which makes sense as we can't spy on this person, and the data is only for a very short time uploaded. So built on this discussion, we decided finally to have the Corona Warning app being a decentralized approach, where the infected user warns all the contacts they had via Bluetooth on the phone, and all data is on the phone. So it's developed by 3 public institutions, which was supported by SAP and the Deutsche Telekom for technical support. It was from the very beginning on published as an open source code on GitHub, and everybody who has some IT skills, they don't, was able to comment on that one and to improve the code further. It's available since the 16th of June. And it firstly started with contact tracing functions only. And then they realized that the communities need more functions, and so they included more functions. But for the very long time, we only had the function of contact tracing, which is also the result why we have so many different apps now. So here we see it was downloaded roughly 43 million times. But that doesn't mean that we also have 43 million users. I mean, that would mean that every second person in Germany uses the app, which they don't. We see that there was a very peak at the beginning, and then we can see peaks where all the waves hit us, where people then started to download it again or download it. On the other side, we have the sharing behavior. You can also see the waves here, and you can also see that more people are sharing positive tests in the warning app right now. The Luca app on the other side, I already mentioned that it was developed by a by musicians. A centralized app. The server claims to be in Germany, but they're not really that transparent about that. And it was developed because this band, I don't know if you've heard of them, they are the rap band Die Fantastischen Vier, rapping in Germany. They said we want to have a cultural life again. So we want bars and restaurants and events to be open again. So we need an app which registers us when we are entering the site. So that was why this app was developed. They do have the source code open now on GitLab, but that was only after 1 year of criticism why it wasn't there. So it's available since March last year. And it started from the very beginning with 2 functions, so contact tracing as well as event registration. And nowadays you just have a tiny little enforcement to use this app, because for every restaurant, bar, concert hall, there's Luca app's QR codes, which you need to scan in order to enter the site. So there's an indirect enforcement, I would say, if you do not want to leave your contact details on a paper version. It still has ongoing privacy problems and data leaks. For instance, just last month, there was a case of a fatal accident in Mainz, where someone died after leaving a pub. And the police actually called the health officers in that area and said that they want all the data from everybody who was there at that day, and the health officers actually used their key to unlock the data of those 21 individuals that they were there, who were then contacted by the police. So we can see there is a misuse in data security and data protection for centralized apps. Here's some numbers from yesterday. So we got 40 million downloads. It's roughly the same as for the Corona warning app. I just ignore that it just ringed at my door. We get some check-ins and we get some warnings. Looking at the Corona warning app, how can we evaluate it? It's actually tricky to evaluate because it doesn't collect any demographical data on us. So if you want to evaluate anything on the Corona warning app, you actually need to conduct surveys. You can't use the data, as it only collects the distance between the individuals and the time, which is the length of time for which they met. So it's hard to evaluate. Looking at effectiveness, it's also hard to evaluate whether it was effective or not, because we didn't introduce just that app, we introduced a whole set of tools to go through and to improve that situation. Nevertheless, I have some demographics for you. They are roughly a year old now, but so I want to show you. So we got a more or less equal share of people that use and do not use the app. And if we look at the demographics, we can see that people with a higher education are more likely to use the app, which you can see here in the blue box. Seems to be more likely to live in bigger towns, are employed, earn more, and have no migration background. And if we look at age, we also see that the younger people seem to be more addressed by the age. So each age group had more or less the same amount of people. And I also like to remind you that this survey was only conducted for smartphone owners. So it's also the techie oldish people that were introduced here. If we compare those 2 apps now, there was a study which compared March-April 2021 to June 2021. And we can see here that the Corona warning app was downloaded and used by most of the participants, while the Luca app was only installed by 12%. And then those numbers changed. So for the next follow-up survey, where they also asked the same 1,719 people, the downloaded numbers for the Corona warning app didn't change much, but more people downloaded the Luca app. And that was because they installed both apps now, which is the indirect enforcement, which I already talked about. If you want to have a social life these days, you need to have the Luca app, which is funny because the Corona warning app actually has the same functions of event registration these days, but people seem to be used to the Luca app and mostly just use the Luca app for that. And we also see that the number of people that do not use an app at all is decreasing by a bit. if we compare trust issues between those two apps, we can see that people are more concerned about their data protection for the Luca app, and that increased. So the blue box here is the first survey, and the orange one is the updated version. So we see that the trust issues increased a lot. We also see that people fear less that the government is spying on them if they use the Luca app. However, data leaks show that legal authorities actually a lot easier to spy on you when you use the Luca app instead of the Corona One app. And most of the people think that the app isn't of any use. That actually brings us to the problem: are they effective? So here is the graphic from the Robert Koch Institute from just yesterday, where you see all the incidence rates. They actually had to invent those and add those two colors to the color scheme because they weren't introduced in the very first place. And although we have 75% of the population vaccinated completely, we have the highest incidence rates right from the very beginning. And the apps don't seem to help the health office much. However, we also need to keep in mind that the government reduced all other interventions and restrictions. So in some areas, you don't even need to wear a face mask. You don't need to register people when they want to enter any event, and you don't need to be tested to enter any event. So we see that all the other interventions were reduced. My ideas why those apps don't help, besides that issue, is the low usage rates. As I said, 40 million downloads doesn't mean 40 million users. And we also have the issue that we don't have free PCR tests anymore in Germany, which was just changed last week. So it used to be, if you have a red flag, which means a corona warning, then you would be available and allowed to have a free PCR test, which normally costs roughly 70 euro in Germany. And only those positive PCR tests would produce a warning to warn other people. However, the rapid tests, which are what we get now, don't produce a red warning, as the test centers need to be connected to the infrastructure of the Corona Warning app, and most of those test centers simply aren't. So that means that most people won't be warned anymore, even though they use the Corona Warning app. Another idea would be that people don't get tested, even though they receive a warning. It's actually a joke of having red warnings like twice a day at least in Germany. And people maybe don't upload a positive result to warn others. The Corona One app has no connection to health offices, so if you don't upload your test, no one will do that for you, and no one will warn your contacts. So I would conclude that they do have potential, but only if used correctly as a supportive intervention, not as the main intervention, by a huge share of the population, and if the code is changed to warn after positive events or after a change in legislation. Looking at the problem with uploading tests, this is the upload behavior of people for PCR tests. So you see the share of positive and negative is roughly the same. However, this is the share for people that are uploading rapid antigen tests. So my assumption is that they only upload negative tests because they want to enter events or go to a restaurant just to have this 2G plus system that we do it now, but they don't upload positive antigen tests. Which is a big problem. So how can we?
5 minutes.
Yeah, how can we improve those contact apps? We need to have high adoption rates and the trust in public. The study by Hinge showed that we need to have at least 15% of the population using it, or 60% of the population if we don't include any other interventions. It needs to be compatible to other health system structures. So if we change the legislation, we should also change the health code. We need to balance the effectiveness of the tool with the side effects for isolation, which is mental health issues. We need to be ethical. So the use should be voluntarily. There should be no indirect or direct force to use that. And we should have equal access to the app for everybody, no matter which phone they're using or the language they speak. We need accompanying research, which we don't do much. So as we all know, this is the first pandemic we have in this digital era, and we need to work on that. We need to create data on how successful those apps are. We also need to keep in mind the legal framework. So the apps need to be transparent and comprehensive to inform everybody. It was nice that the Corona Warning app published the code, but if you don't have any knowledge on IT, you don't really get much out of that. So we need to be more transparent and more inclusive on this data sharing approach. We should only use data for the specified purpose and delete it afterwards, and collect only absolutely necessary data. And if we don't do that, then we should use anonymized data as much as possible. And last but not least, we need to look at the technology. It should be designed to sync the public health authorities together with the individual end user. And we should use our functions based on the maximum participation issue. So we have quite a functions to measure contact tracing. However, although ultra wideband tech is the state of the art, it's like the best and the cheapest and perfect, not many phones are currently able to use that. So it isn't always a good idea to go for the best. And nevertheless, keep in mind the open source code. Thank you.
Thank you, Laura Maaß, for your great presentation. You brought us a lot of interesting topics here, mainly the issue of voluntary versus obligatory. I think we need to have a way to improve the adoption of the technology. So we need to understand how this can be done, and so we can discuss that later. Thank you very much. I will pass the floor to Mariana Peyroteo, please. She will talk about the overview of the COVID contact tracing in Europe and about the study that we are been doing in Portugal. Please, Mariana.
Hi, good morning. I think you can see my screen. Is it in presentation mode?
Yes, yes, yes.
Okay. So, good morning, everybody. I'm Mariana Peyroteo. I'm from Nova University of Lisbon. And today I will talk about a little bit of an overview of the contact tracing apps in Europe and their potential for managing an epidemic. And also about, I will just short present a little a modeling study that has been organized in Nova University of Lisbon. So, as I said, okay, I will talk about a little bit of the approach used in the contact tracing apps that Laura already has really explained really well. So I will just share my screen, not much. I will also share about a little bit of the overview of the contact tracing apps in Europe and talk a little bit more of the Portuguese study that I will not get into much details because Márcia will talk also a little bit after, and then I will present our case study in Portuguese, in Portugal. So as already Laura mentioned, the contact tracing app approach is basically the contact tracing apps are installed in the mobile system and notify users if they have been close for a certain period of time to a person who tests positive of COVID-19. And then the app must give relevant information from health authorities and what are the next steps, if it's to get a test, if it's to get treatment, if it's to be in isolation. So this is the main approach. And technically, most of the contact tracing apps in Europe are, like Laura said, a decentralized approach. So what happens is the person, even if it's healthy or infected, they download the app, and then the health authorities, if it sees it's an infected person, they assign a code. That code will automatically be in one database, that it's the list of infected people, and in that way the health authorities have the codes and the name of the person, so they can identify it. But what happens to the app, it's they generate a random key, so they can't identify the person to that key, so it's pseudo-anonymized, and then they will upload in another database. That's the database that is in the system and in the app, and that will be shared from the infected people to the healthy people. So in December 19, World Health Organization said that COVID-19 is a disease outbreak, and in 1 month later, it's already a public health emergency of international importance. And in March 2020, we all know that it has been said that is a pandemic. And from that point on, all the countries had to use their resources to try to get a solution and to respond to this pandemic situation. So in April 2020, Márcia has implemented their first contact tracing app, and we will see from the 27 countries, 19 have been developed their contact tracing app, and most of them are the same in the approach. They are a decentralized approach, but the difference is mainly of the security and privacy issues, because they have to respect European databases and security issues, but also the national and legal boundaries. So the main difference of the different contact tracing apps in Europe are within the security and privacy issues. So first it was Márcia, and then in May of 2020 we have Hungary and Latvia. In June, it was like the big development within the contact tracing apps. That is Austria, Poland, Italy, France, and Germany. One curiosity that it's funny, not much funny, but it's interesting to mention, is that in France, first was launched the Stop COVID app, but it was a failure. So France just changed the app's name and all the interface changed the name, and it's to anti-COVID, and now it's the main contact tracing app used in France. Then in July we have Ireland and Croatia, then August, Spain, Estonia, and Slovenia. In September we have Belgium, Denmark, and Portugal. In October, the Netherlands. September we have Lithuania, Switzerland, and by the end of the year, at least the beginning of 2021, we have Cyprus. So after all of this, it's important to know that, for example, Finland is one of the countries that we have access to the development and the technical issues about the development of the contact tracing app. But, for example, we can see that in Luxembourg and Sweden and Bulgaria, we don't have access to the development of the contact tracing app. Also, Slovakia and Greece, we can see that the contact tracing app is under development. So let's see where's the problem. As Laura mentioned, this is the basic approach, but when if some steps of the process fails, for example, if people don't download the app, so the adherence is lower, if the health authorities don't have access to the keys and the apps of the infected person, if the Bluetooth fails, we can't have the apps working clearly. So it actually made a little a controversial issue in the media, because we could see that most of the apps are failing, and it lowers the efficiency and the trustness of these apps, and it fails in everything. So let's see what happens in Portugal. So the Stay Away COVID, it's the app. It's the same approach as the majority of the apps in Europe. So after the diagnosis to COVID-19, it's the patient that has, like in German, that has to put in the app and in the system. And then it gets recommendations. So you have to get a PCR test, you have to isolation, you have to do this. And if the user was in contact in the last 14 days, the application immediately alerts them and suggests their isolation and that they have in contact with health authorities. So also the data security privacy is the same. It's a pseudo-anonymized. They have random key numbers, and the only thing that other people in the system have access, it's the random key number and not the identification code. But in here, we can see some of the comments, and this is true opinions. These are true opinions of users in Portugal. So some say that they always have to Bluetooth on, so they consume a lot of battery. Some of them say it's not useful. Some of them didn't understand how the app works, and it wasn't mandatory, so the low adherence of the app actually fails of all the approach. So there are 3 problems associated with this current model. First one is a technological problem of lack of precision in the interaction between smartphones. Then the significant idiocy by part of population safely and privately. So special people infected with COVID, because if all the healthy people has the app, it's okay. But if, like Laura mentioned, if the infected people doesn't put it in the app, they are infected, it's not efficient. So it fails in the main issue. And some countries are already using this feature, that is including behavior management models, especially in certain locations. And so into the future, what can we do? We already know that failures leads to research and learning. And nowadays, what we are doing, all the world are doing, is research. So there are a lot of reviewers and papers in review about the evaluation assessment of the COVID tracing apps that are already implemented. There are modeling and simulation methodologies and studies that are being already organized and done. And in this way, we can learn that in the future there are, and this is all that Laura already mentioned, there are 2 main issues. We have in the contact tracing apps that we're going to develop and to improve. So we have to ensure that the quality of the technological process is guaranteed. So the app works in the correct way that it's supposed to do, and also ensure of the balance of the trying to contain the spread and the transmission of the pandemic and the privacy issues, not only the European ones, but also the national ones. So we have to ensure that although we have to contain the transmission, we have to respect everyone's privacy. So in this way, we can ensure that the reliability of the contact tracing apps and try to higher the adherence and try to focus more on the using of the app, that it's the basis of all the contact tracing apps. So this is the example of the public health at campus FCT, that is the Faculty of Science and Technological in the Nova University of Lisbon in Portugal. So this is a simulation to be carried out in the university campus context to control and spread of a disease by managing its transmission. So in this way, we can assess with an existing technological process without Bluetooth. We're trying to figure out which technology is the best, and that could be useful for managing epidemics and public health. In this way, we can assess the human behavior, considering, for example, their efficiency on the contact tracing application and the adherence to the app, that is the main issue, and also the distribution of people approaching and to reduce the probability of spreading the virus. So this modeling study will allow us to replicate and explore and compare real scenarios in a pandemic context based on the assessment of this data. And the most important thing is that it can serve a decision support model for preparedness in other pandemic contexts. So thank you very much for your attention. If you have any question, you can contact me and Professor Luís.
Thank you, Mariana, for your presentation. Very interesting. You show us very interesting aspects about the failures of the system, mainly one of which is basic, because they seem to fail to look at the needs and the requirements of the population, of the people. So they were very much focused on the needs of the health authorities and forgot the perspective of the people, of the population. So keep this in mind. We'll talk about that in the discussion. So now we came to the last presentation by Márcia Luís. So came from the Universidade de Lisboa. Please, the floor is yours. Thank you.
Thank you. I hope you can see the presentation now.
Not yet. It's coming.
It's coming.
It's ready now. Can carry on.
Okay, great. So my name is Márcia. I'm from the University of Lisbon. And to complement the great presentations of Laura and Mariana, today I'm going to show you how we can model contact tracing. So I'm going to present you a mathematical epidemiological model that I have been working on the last months, and it aims to simulate and reproduce the COVID-19 epidemic in Portugal since its beginning until February 2021, which takes 1 year of the epidemic. And using this model, we can then understand and explore many scenarios interventions, including the effect of additional contact tracing efforts in Portugal. So the main objective here is to explore what could have happened if you had increased effort in tracing and isolating more infected contacts than the contacts reached in Portugal during our period of study. And for this, we simulate 3 different scenarios, which consist of tracing and isolating more 5 and 10% infected contacts when implemented at 3 different moments of the epidemic. Since May 2020, which corresponds to a low period of transmission because it is with the lift of the first state of emergency. The second scenario consists implementing this 5 and 10% tracing effort since September 2020 with schools reopening, and the third since November 2020, which corresponds to the second COVID-19 epidemic wave that occurred in Portugal, and it represents a period of high transmission rates. So for this, we developed a mathematical compartment model, which aims to split the population according to their infection and disease status. In fact, it is an extension of the classic SEIR model, which split the population into susceptible, exposed, infectious, and recovered states. And due to the complexity of COVID-19 disease, we also include other compartments to distinguish people who develop an asymptomatic infection from clinical infection, where we also distinguish a pre-symptomatic period from a symptomatic period when people start developing their clinical symptoms. We also include compartments for the severity of the disease by including compartments for people who may require medical care going into hospitals, or in more serious case, they may go to ICUs. In the worst case, they might die by COVID-19, and then they go to this stage. This model is also split by age groups. We also include the heterogeneities of the Portuguese population, including demographic structure, their social contact patterns using contact matrices, and age-specific rates. And among others, assumptions that we have to make, we also include realistic distributions of the infectious periods by including using the method of stage. The method of stage, it just replace a single compartment as it is usually employed by a series of several subcompartments. And you can take this example looking into the infectious asymptomatic state, where instead of having 1 compartment, we have employed 4 subcompartments. But just to illustrate this effect of the method of stage in the distribution, the method of stage permits capturing a bell-shaped curve as the ones represented here by the dot and dash lines. And biologically, it permits capturing the effect of infectiousness starts at some point in time. It starts increasing gradually until it reaches its peak. And from that moment, it starts decreasing gradually. And in contrast, when we assume an exponential distribution, and as it is usually seen in most modeling studies, infectiousness starts, people starts automatically infectious. And if you want to look for the incubation and infectious period of COVID-19, we can see that both of these periods are well represented, are well distributed by a non-exponential distribution. In fact, they were close to a fit gamma. They were fit to a gamma distribution, exactly. So once we have this model and all the equations made, we then can fit the model to demographic and epidemiological data, in this case for Portugal, where we include cumulative infections and deaths by age groups, and also the number of patients in hospitals and ICU, which were publicly available. This model, this process of calibration, it's important when we want to capture this, the epidemic in Portugal through the data, but it permits also estimating parameters that we don't know. And it was the case of the transmission rate that occurred in Portugal during our period. And so this red line represents the model that best fit the data publicly available, and it is our baseline model. So with this baseline model, which permits now simulate the epidemic in Portugal, now we can understand the effect and explore the effect of additional contact tracing efforts. And to do so, we expand our baseline model by including more compartments to represent these traced and isolated compartments. Just a side note, and it is essential to bear in mind that the effectiveness of contact tracing is essentially depends essentially on the capacity of removing infected contacts from the community, and these affected contacts might be already infectious or not. So therefore, the compartment that we include, the additional compartment that we include here, represents compartments that people will be traced and isolated, might be already in their exposed, asymptomatic, presymptomatic, or symptomatic periods. And since our objectives is detecting the effect of introducing 5 and 10% more efforts, we will also remove, therefore we will remove 5 or 10% of individuals of each these compartments: asymptomatic, exposed, presymptomatic, and symptomatic. And once these traced contacts, infected contacts, will be isolated, they are isolated and they cannot spread infections. They perfectly comply with the quarantine and isolation orders. So under this model extended and with all parameters known for to simulate this model, we now can simulate the 3 scenarios and understand what could have happened if you had increased the if you had increased the number of infected contacts. I have just a little problem here. Sorry. So with the results, so we have done the simulate, and if you want to know what would happen, we can see regarding the number of infections, it is illustrated by these 6 panels here, where the first row represents the additional efforts when we implement since May 2020. The second row of panels represents the second scenario when we implement the efforts since September 2020, and the third row represents the third scenario when we introduced the efforts since November 2020. And as you can see, in overall, all scenarios could reduce the daily number of infections, as it is represented at the left, with the panels at the left. However, it is clear that there is a great differences between these 3 scenarios, when a lower number of infections would be obtained when implemented early as it was in May. In contrast, when we implement it since September or since November. And looking at the cumulative number of cases at the end of the simulation, we can see that they will reduce the total number of case infections. However, again, in the first case, in the first scenario, when implemented since May, we will obtain a higher decrease in the number of infections. Looking now into the number of hospitalizations and ICUs, I think I'm having a problem with the slide. Okay, looking at the demand of healthcare services we can still observe that all scenarios could reduce the pressure in the hospitals that are presented at the left, and could reduce the pressure in ICUs, in intensive care units, which are shown here at the right. And again, they will reduce this pressure, and importantly, they could reduce the burden of the third COVID-19 epidemic wave in January, which in fact we were really close to our limits of capacity, which is depicted by this dashed line, which represents the baseline model without any additional contact tracing efforts, and this horizontal dot line, which represents a reference value for the number of beds in hospitals and ICUs. And we can see that we were really close to these limits. And under these all scenarios, under 5 and 10% of scenarios since May, since September, and since November, we could diminish these curves to lower values. This value of number of beds in hospitals and ICUs, it's just a reference value, but it permits giving an idea how close or how far we are from these limits of beds capacity. And looking now into the number of deaths over the course of the epidemic, just a moment. Brilliant. Having some problems with the PowerPoint. Just a moment.
Okay, don't worry.
Yeah, it's now. Sorry, it's a little bit slow. But looking with to the deaths that we would obtain under 5% of tracing and 10% of tracing efforts, we could observe still a proportional decrease in the number of deaths in the three scenarios, similar to the decrease observed in infections and also in the demand on healthcare systems. So overall, all scenarios could avert a large fraction of the number of infections over the course of infection, but it is clear that this fraction is different across the three scenarios, and it diminishes when we implement these efforts later in the course of the epidemic. In the first case, we could see that we could avert 95 to 99% of infections when implemented since May. When we go to the second scenario, when we implement since September, we could reduce 65% to 85% of infections. And when implemented since November, we could reduce 35 to 65% of infections. And it is also interesting to know that, and expectedly maybe, that 10% of tracing would also lead to a higher number of infections averted than 5% of tracing. You can see that this blue curve is higher than this red curve. So it is also interesting to look into the number of contacts, infected contacts, that we should trace and isolate in each case in order to avert the number of infections seen before. And at the first slide, we can see that the number of infected contacts that we need to trace increase over the three scenarios. With the first, and looking at the peak of tracing, under this 10% of tracing, we will need to reach 80 contacts in this day. If you look into the second scenario, the maximum we would reach 400 contacts, which is 5 times larger than the first one. And in the third scenario, we will need to reach almost 2,000 contacts, which is again 5 times larger than the peak of tracing, the 400 contacts. And it is in fact, it is a reasonable result, since the number of contacts, it is associated, is correlated with the number of infectious cases at the time, because when we have more infectious cases, we will also have more contact, and among these contacts, a higher proportion will develop the infection. So it is clear that in November 2020, we had more infectious cases, and therefore we had to trace more infected contacts to reduce the epidemic, as we saw before. And of course, or obviously, if you have more infected contacts to trace, we need more human resources to detect and trace these infected contacts. And just to give you an idea, and without diving into detail, in the worst case, when we had to trace these nearly 2,000 of contacts under 10% of tracing since November, and when accounting for their respective contacts, we will need approximately 776 contact tracers to trace these infected contacts. I think it's important to underline that these 776 contact tracers needed is the number of people we need to trace these infected contacts and their respective contacts. And if you look to contact tracing made by humans, there are a lot of contacts that will be traced and isolated without developing an infection in the future. So this value is just a value, but in reality, it might imply many more contact tracers. And I think the power of digital tracing comes here when it is well developed, through the development of mobile apps that has been developed in many countries and talked before, and it was also successfully employed in many other countries. It permits detecting high-risk contacts that will develop an infection in the future, and permits non-quarantining non-infected people. So therefore, under this idealistic contact tracing made by digital tracing or other technologies, when they are well developed under all the concerns, under all the privacy concerns, if they could get the number of infected contacts that we estimate here with our models, with our simulations, we could reduce the number of infections, death, and depression in healthcare systems at the same levels as we obtain in our results. However, it is important to note, and it should be also noted, that this digital tracing and these values assume that people comply perfectly with quarantine and isolation orders, as I mentioned previously. And in the real world, this might be a little bit unrealistic. And therefore, if people not adhere totally with these measures, the number of the impact obtained with these simulations will be lower, and consequently, the number of infections will be consequently be minor. So, nevertheless, having this possibility of a great and powerful digital tool can really get a really good impact on the epidemic, and especially when we implement early in the infection, when we have fewer infectious cases. So thank you. I will be open to questions and discussion if we have need.
Very good. Thank you, Márcia, for this amazing presentation and very interesting study. It shows us that we shouldn't stop dreaming about using contact tracing. That's why we are here to discuss this. I have a couple of questions already to ask the three of you, and wait for others to participate if they want. And in the discussion, Laura, you talked about. I have two questions at the same time. So you talked about the use of apps in an app store regarding public health, and at the same time you talked about the issue of trust, the issue of Germany. I remember when I was studying in Germany many years ago, I was the I was almost the only one using credit cards, because everyone was using money, so they didn't trust the credit cards. So I see there is this Germanic approach to understand the role of data. I think it's also a worry that we share, because perhaps in less importance, but we also share this worry about the trust. But how can we have trust and think about this in a world that is becoming more and more fake news oriented? Okay, there is a big business regarding fake news. How can we actually manage to at the same time look at improve the trust of the population, and as you have shown something there, and also how can we look at the apps that are available? Shall we have regulations on that as well? So what do you think about that? Thank you.
Great questions. First of all, we still like to use cash. So nothing really changed in that case since you've left Germany. People still refuse to accept credit cards. So much for that economical impact of trust issues, but we're improving, especially since Apple Pay. So concerning your questions, we're actually doing 2 studies on those questions that might help you with answering. So one is a study that colleagues of mine conducted on social media on spread of fake news and how to implement a nudging intervention to stop people from spreading. And that one is going to be published soon in Nature Behavior, I guess. I'll let you know once it's out there. And they developed an algorithm to nudge people when they wanted to share fake news, which also linked them to the, which also told them, like, okay, your community from your community, no one really shared that. Are you certain that this source is trustworthy, and do you still want to share it? So they used that on, I think it was Twitter. And then they also had another intervention where people got this nudge and added to that a reliable source of that information. And they figured out that even just the nudging intervention itself, without the need to link them to reliable sources, already decreased the spread of fake news on social media. So that's one study that we conducted, and that's going to come out soon. Concerning apps and quality assessment, especially of apps. I mean, there are private individuals programming public health apps, and there are also economically interested parties developing public health apps and collecting our data. There is going to be, from Leiden University, a quality assessment based on ISO certification, which they want to spread to hopefully the whole world, but they start with Europe, to actually rank apps based on the energy consumption label, which you probably all know from your fridge, like A+, A, B, C, D. And they want to adopt that to every app within the app, every health app within the App Store. Because right now developers have, for every country, different frameworks which they need to address in order to be published and to be available in the specific market. And they want to have that one, which is combining all different frameworks. So we can assure at least a bit of quality within health apps. However, looking at trust, I think it is always important to be transparent. So I think open source coding is a good idea to start with. However, as you're not an IT specialist, you don't really get much out of, oh, well, there's this open source code. So what do I do now with all those 1001111s? Doesn't help me much. So we need people to explain that to us. And it's best if those people aren't private individuals, aren't economical interested parties, and are not the government. So that actually makes us, the researchers, the party that people, based on statistics, trust most, and that we should always be involved when it comes to the development and implementation of public health and digital public health interventions, may it be contact tracing apps or different other ideas. And I think having those parties included can help people to be more trustworthy towards an intervention.
Thank you very much, Laura. Maaß, thank you. I think you pointed out very well the issues, and of course we need to have more quality control of all these technologies. They are emerging, and so we need to learn how to adopt these methods so we can be more reliable on them. Thank you very much. I now pass to Mariana Peyroteo. It's very much linked with this. So you show us that there were a lot of approaches in Europe regarding contact tracing, but most of them are similar. So it seems that there was a kind of lack of innovation here. So everyone was doing the same. And what kind of other technologies you mentioned? How can we use different approaches, different technologies to improve the functioning of this trace COVID contact tracing approach? And at the same time, you mentioned the campus. And do you think this kind of application of trying to understand what's going on in the campus, how many people are infected, or so we have a better approach, understanding what's going on instead of trying to collect all the information, but understanding the risks, a kind of risk assessment. Try to it's more interesting. And can we apply it elsewhere other than the campus? Thank you, Mariana.
Hi. So, okay, regarding the first one, I think the major issue is that when we have a technological application, we have to ensure, like you said in the end of my presentation, the needs and what the population can have. So we have a lot of other technologies, 5G, 4G, GPS, and everything, but the most common and what most of the phones and mobile phones have in the population is Bluetooth. So it's the lowest technology and the most common one. So I think the primary issue that all the governments and all the approaches have is to ensure that most of the population can have the app. Nevertheless, the problem is no one wants to download it. So if it's not mandatory, most of the people didn't adhere to the app. So although they can have the app, they don't want to download it. So that's another issue. So we can have like the most innovative technology, but if people don't want to use it, we can do anything. The vice versa is happening the same. It's like we can't have, and that's what happened. The technology, it's not enough. It's not the most reliable because Bluetooth has a lot of issues, and people don't use the app because the app fails. So the trustness is lower. So it's a really triggering issue. And that leads to the second answer. It's that the first I think we have to do is to see in the real world with modeling and simulation approaches what is happening, what can function better in the real world. And that's why the campus university is one of the easiest and the fastest way to see that. Because in a hallway we can see with a lot of different contact tracing and different students and different people within the short space, we can see if the technology is working and if the app is doing their job and what is failing. And in this way, we can explore the difference, what is the issues, what is failing, what can be improved, and then we can pass it into a different, for example, different contexts, for example, shows and stadiums, and then we can see what happens in the population in general, in cities and in countries. I don't know if answered the
Mariana,
question.
for your answer. Very nice. And I will go now to Márcia, Luís. you brought a lot of data, a lot of results.
Yes.
You brought us a kind of, as you said, a dream world. But I think we, in public health, we like to dream that we could leverage these technologies to provide a better approach and better public health to the population. And I would like to ask you a very clear question. Imagine that you met someone responsible for developing the contact tracing app in Portugal. What would you suggest to them about what should we do regarding that? This question is very much related with the one that Leonor Nicolau put on the chat. But so how can you think we could go through this to have this kind of dream world you mentioned? Thank you.
I think firstly, this dream world, we need to have this app that Mariana also talked really well about. We have to need an app that looks into the privacy of people, and we have to make that a lot of people, a significant fraction of the population, use these apps. And I think if you show them the results, the impact that these apps can have on the evolution of the epidemic, we might touch them and appeal them to this sense. We could get out of this epidemic, or we could reduce this epidemic if you can really use it properly and effectively. But again, these apps need to be well developed. The accuracy, the trustness I think are important factors that should be worked to make this happen. Overall, I think that's the main points.
I'll keep that with you. So one of the critical points is we need a large adherence of the people. And why do you think it's possible? You mentioned the ethical issues and all that. Do you think it's possible, considering the pandemics as a kind of war situation, to force people, create a mandatory approach that people should use the app so you can walk around and in a more safety way? Do you consider it's possible to have an ethical approach using a mandatory approach?
In fact, I think each person should have this ability to choose if they want or not stay at home and comply with quarantine and isolation orders. Because in the real world, we know that there are several people that might not stay at home because they have to work to sustain their family. And this is a tricky issue, because governments may also, to guarantee that these people with lower social income may guarantee to be at home, and governments maybe have to impose some economic help to these people, because we know that the levels of economic status may have it is an important factor for reducing their mobility or not, and also if they comply or not with the measures. So I think there's a lot of questions that it is hard to it is still hard to understand at which point, or at some extent, we can make these people or not make these people to stay at home or not.
Thank you very much. Thank you, Márcia. I have a question from Stefan. Please.
Yeah, just a comment, because you talked about problems why contact tracing app failed, and I think two big problems have not been mentioned. One of it is that the situation changed. We had a long time we had anonymous contacts with no masks. So if you walked somewhere, you met people without masks and could be infected. So that was the beginning of the pandemic. But now masks are present very good in official ways. So the problem now is that the app cannot discriminate if the contact and I were wearing a mask. So if you have now high numbers of cases, you have high numbers of false positive maybe results, and you go into that direction of pandemic. And so I think this is one of the problem, and another problem is also when the warning is anonymous. How can I be sure that my colleague, which I met yesterday, that he has received my warning when I'm positive today, and I want to know, is he warned or not? I have no feedback from the app if my friend has been warned or not. So what I must do, I must call him myself and notify him by myself to be sure that he is warned and he can go to quarantine. So I think these are two important points, and if I may, I'm just a promoter of self-initiative warning. This is a very simple information system. You don't need technique or something like that. But if you instruct people to warn others when you have a positive test, then you do effectively contact tracing, and the person has the chance to do a quarantine-like behavior. At best, could go in quarantine, and if not, he's warned. He can change his behavior. He can wear a mask when he meet other people until the time he is sure that he is not infected. Thank you.
Thank you, Stefan, for these valuable comments. And I will ask the participants, to the speakers, to try to respond or to address these two aspects that we're not covering here. Mariana, please.
Thank you. I was just, this can link the comments that I have before and answering Stefan's comments. So Márcia was answering about the mandatory question or the mandatory measure and everything. But what I can see, it's, for example, from the Portuguese app, it's all the users have to have a proactive approach. In this way, when they received the positive result for COVID, they received a code that it's the health authorities that assign, and then with that code they can insert in the app. Okay, so it's the user that can choose if they want to add to the app or not. And Laura mentioned that, for example, for antigens tests and the rapid tests, most of the people didn't put it. Okay, so it's not mandatory. Although most of them can put it, and they put when they want to enter the restaurants, they want to get out of the country. So within all the Europe, it's not mandatory to have the app and to put it if we have a positive or negative test, but it's mandatory to enter some places. So in this way, we can manage and ensure that in some places we can have that tracing. In other way, like Stefan mentioned, we have to ensure that all the things are working properly for us not to doubt if the app is working or not. For example, if in the Portuguese example, if the health authorities automatically, when we have a positive result, add it to the app, and with that random key, we can find all the people that you have in contact, you can ensure that all the people have been worn out. So you don't have to call the people and see, okay, did you receive my notification? I'm positive. So first of all, we have to the reliability of the app. It's lower when we know that it's a proactive approach from the users. So when we ensure that the measures made are automatically, and we can choose if the person is going to add the results, you can ensure that the app is working properly. So this is a way that it's not mandatory to download the app or everything, but if you have the app, it's a trust it's a trust. You have a trust issue in there.
Thank you, Mariana. Laura, do you like to comment on these both issues raised by Stefan and the issue of the mandatory approach of contact tracing, please?
I would love to say, yes, make them all mandatory and everybody needs to download that. However, I fear that's not ethical. And I also think it's not doable because of technical reasons. You know, that we in Germany love our phones. And I know lots of people that have 10-year-old smartphones and still use them, which you can't upload or download the app at all. So I don't think mandatory is the way to go. Also because I know my fellow Germans and their reaction to enforcement of downloading apps. I am a big fan of 2G plus, where you need to have a negatively uploaded certificate in your app in order to access and enter sites. However, we stopped doing that now in Germany because reasons. And I think that's something that you could make mandatory. In theory, I also would like to have like a parallel system where you can upload your positive test yourself, or that the health authorities can upload it then. So it's like a centralized version. But as I've talked about, that one is then accessible for spying and for data misuse by other authorities, which would eliminate the trust in the app as well. So I fear it's a bit of pest or cholera, the discussion that we have, and we need to decide for one and then follow the path.
Thank you very much. We have another question from or comment from Paula Herrera, please.
Yes, hi. Good morning, everybody. Yes, my name is Paula. Following actually on your initial question on trust, and independently of the technological challenges of having people download a native app, I was wondering what role does the user design and maybe like the story behind the app play for its adoption? And I had this question from Laura's presentation, actually, because I was thinking about which reasons might be associated to the use of an app like Luca versus the originally governmental one, such as the Warn app. So I was wondering, maybe Laura has some comments on whether the user design of these apps or the nature of them coming from the private or public authorities played a significant role at the beginning or not.
Thank you very much, Paula. We still have a couple of minutes. Laura, please, could you reply?
Sure. Hi, Paula. Great question. I think it's a bit weird that people love the Luca app, even though of its criticism, and that it collects data. I mean, I don't see why it needs my birthday and my mail address and my phone number and my my living address and my sex, but it's all collecting those data, and you agree when you're downloading the app to give all those data, whereas the Corona warning app doesn't collect any of that at all. So there's this gap which doesn't get in my mind. When I think what I think the main reason is path dependency. When at the very beginning of the Luca app, it was the only app that generated this QR code, which you could use to check into events or locations. And whereas the Corona warning app introduced this function just months later, when everybody was already using and used to the Luca app. So I think if the Corona warning app would have had this function from the very beginning, then I think there wouldn't have been any Luca app at all. But now that we have this path dependency, everybody is used to using this Luca app. So we're just using it. And I don't think it has anything to do with data protection or data safety or any concerns. It's just that, or mostly that.
Okay, thank you very much, everyone. I think we are on the time now. Just to say a couple of words. Thank you for the speakers. It was very interesting. I think we can think about doing this in 1 year from now. If there is more results from contact tracing, we can have another webinar in 1 year from now, so we can see the future is coming or not. So thank you very much, everyone, for participating. We still we can still discuss this issue, exchange mails with Ines, so we can keep talking about this. So enjoying the remaining of the day. Thank you very much to everyone. See you next time. Bye-bye.